Good day to everyone. I'm Dr. Gabriel Distor, and I'm here to present my research paper entitled Early Surgical Site Infections Among Patients with Closed Appendicular Fractures Surgically Treated in a Tertiary Hospital. Surgical site infections are defined as infections of incision or organ space that occur after surgery. It is determined as early if detected within 30 days and late if occurring after 30 days. Time to presentation indicates whether the infection occurs secondary to perioperative processes preventable by evidence-based strategies. It remains a debilitating morbidity among patients who underwent surgery for various conditions, with consequences including rehospitalization, risk for multiple surgeries and anesthetic procedures, and longer hospital stay for the patient. The objectives of the study are as follows. This is a single-center cross-sectional analytical study conducted from July 2020 to December 2021. During this time period, patients for elective surgery were tabulated and reviewed for inclusion in the study. Data were collected pre- and post-operatively, and perioperative processes were noted, namely as follows. Patients aged 18 to 85 with closed appendicular injuries are surgically treated were enrolled in the study. They were monitored for 30 days for the development of early surgical site infection. Injuries previously treated surgically on the affected extremity and associated with open fractures or lacerations are excluded. The patients were monitored for the development of SSIs clinically defined as follows. Recorded within 30 days during admission and not follow-up in the outpatient department. If these signs develop after the said time frame, they were not recorded as early SSIs. Statistical analysis that were done were as follows. Our study included 264 closed injury cases, the majority of whom were male, with a median age of 36 years old, with a large percentage from the 21 to 30 years old age brackets. Surgical site infection occurred in our group with an incidence of 2.65. The most common type was the note of presence of erythema. The median length for the procedure studied was 150 minutes. A larger percentage of the cases were performed with a median length of 61 to less than 120 minutes. All of them had surgical antibiotic prophylaxis, which in turn was administered 30 minutes before incision among 61.98% of our study participants. 94% did not receive any subsequent antibiotic administration during the procedure, while 98.86% continued the antibiotics post-surgery. Odds ratio presented in Table 4 also increases with the length of the operative procedure. For example, in procedures done in less than 120 minutes, we found an odds of 1.1. A procedure with more than 240 minutes duration has an odds of 3.0. This is also observed among patients whose surgical antibiotic prophylaxis were given at more than 120 minutes. Approximately 1% of patients undergoing orthopedic procedures develop surgical site infections. Other studies have recorded incidences of 2.55% to 41.9%. An increase in odds ratio with increased duration of procedure is observed. This is true for other studies which have shown that prolonged operative time increases the risks of SSI, with the likelihood of growing proportionately with time increments of 30 minutes. With an odds of 1.4, the benefit or possible harm of use of adhesive skin drapes remains to be inconclusive as reported by several guidelines and recommendations. There is also an observed increase in odds with prolonged time before the wound dressing comparing day 2 to day 3. Although insignificant, earlier wound dressing for clean cases may be protective for surgical site infections, as risks such as soaking are promptly addressed at this time. Our study observed a 9-fold increase in odds in patients whose antibiotics were given more than 120 minutes before cutting. No significant difference was noted between giving it within 30 minutes or 60 minutes. This finding remains to be consistent with reports of several studies and guidelines associating the time of prophylaxis before incision. This study found a relatively low incidence of surgical site infections in the institution. Despite that, it is still advised to improve outcomes and decrease the incidence of SSIs with measures such as reducing operative time, preoperative bathing, and proper timing of surgical antibiotic prophylaxis. Surveillance of surgical site infections may help improve modifiable perioperative practices and risks in the local setting and ensure a continual improvement in overall patient care and institutional management. These are my references. Thank you for listening.